Second, please use the chat function for technical questions only. For questions for our panelists, please use the Q&A feature. Lastly, we will be sending out to everyone registered the link to the recording and the resources that our panelists discuss, as well as their PowerPoint presentations next week. As always, if you have any questions, feel free to reach out to us at any time. Anne?
Thanks, Judy. Thanks so much. Judy and Jen are our hosts this evening, and we have two great speakers joining us this evening. Let me talk a little bit about, my name is Ann Jones, and I'm a registered nurse, retired now after many years in healthcare, and Vice Chair of Healthcare for All Minnesota, Chair of the Education and Outreach Program that we do. Welcome this evening. This is about how big money is sabotaging our efforts to fix how we pay for healthcare in Minnesota and the U.S. As to why this program at this time, it would be hard to overstate the influence of money on our politics, both on elections and on legislation. Who runs and who wins, which legislation even makes it to getting hearings, never mind getting passed. No matter which candidates and office holders you support and which issues you care about, big money, often hidden and unaccountable, is affecting any ability to make progress on these issues. So we're all here because we care about fixing how we pay for healthcare, but of course that affects a lot of other things. And there's no sugarcoating this. We in the single payer healthcare financing advocates have the policy with us. We have the economics. We even have public opinion when the question is asked correctly on our side. But we are up against powerful, well-financed opposition to disrupting the business model of the for-profit side of healthcare. Tonight, we're going to talk about the corrosive influence of money on our politics and especially on our efforts to fix this. And also what we can do about it. Just for a little bit of context, and in case you needed any more evidence about what we're up against, this graph is from Nation on the Take by Wendell Potter and Nick Penniman, and it really paints the picture for us. Look at the very top of the graph and you'll see that why this is such a concern for those of us worrying about fixing how we pay for healthcare. Spending by lobbyists to influence legislation influencing healthcare, the healthcare system literally tops every other sector of our economy, including the financial services industry, media and communications, the fossil fuel industry, even defense contracting. I don't say this to scare us all too much, but just to give us a realistic look at big money as a barrier to change. So our program for this evening is, we will start out with a video that is produced by a great organization called fixithealthcare.com. And you can, Jen has worked on condensing a 45-minute video into 15 minutes, and I think she's done a wonderful job. This will set the context for us for this evening, and you can go to the complete video at fixithealthcare.com. It's called The Big Money Agenda. Then we're going to hear from Jeff Clark, who is the co-chair of the Minnesota chapter of Move to Amend and a partner organization for Healthcare for All Minnesota. Jeff's talk will include some actions that you can take to push back against the influence of big money. After that, super activist Linda Gridley is going to show us how to follow the money with some examples of what's going on right now and resources you can use to find information for yourself. We do have a few minutes for questions after each of these speakers, and we'll try to get to as many as we can. You can put your questions in the Q&A portion of your Zoom screen. And then Jen Crawford is the Executive Director of Physicians for a National Health Program, Minnesota. I'm going to pinch hit a little bit for Jen because she's not feeling very well this evening, but we're going to talk about two of the biggest threats to on the horizon to Medicare for All single payer financing, and Jen's going to throw in her comments if I miss anything. And then lastly, I have a few announcements and opportunities to volunteer as we start to do some in-person outreach events this spring and summer. And I'll also talk about a fundraiser that we have coming up in May. So with that, I will let our host pull up our video.
Every law and rule is scrutinized by lobbyists, and that ensures that, in combination with the contributions, that every law and rule is spun to the advantage of the special interest, which means that almost nothing is ever advanced, in the common interest, which fundamentally undermines the republic.
Whenever a piece of legislation comes before Congress that would have a broad positive effect on the common good, it either gets derailed or gutted.
Things that the American public want just aren't considered seriously. There may not be any better example than the debate over health care that led to the passage of the Affordable Care Act.
During the debate over what became the Affordable Care Act, more than 4,500 lobbyists swarmed the Capitol. That's 8 lobbyists for every member of Congress. $1.2 billion was spent overall.
Pharma alone spent $266 million to make sure that the Affordable Care Act would not include any controls on drug prices. The return on investment to influence Congress, whether by lobbying, campaign funding, or PR ads, is immense. The Sunlight Foundation did a several-year study to track the payoff on lobbying and campaign finance investment. They found that while Big Pharma spent tens of millions of dollars lobbying to prevent Medicare from negotiating drug prices, it got Pharma tens of billions of dollars in profits in return. Across the board, lobbying investments pay off in massive profits or massive tax cuts, while working people and small businesses pay the price.
The current political system denies citizens equal representation inside of a representative government.
Our democracy is at stake with this issue.
So the history of the U.S. is a history of the ebb and flow of corruption and money that infiltrates our system, leading up to the 1970s when massive campaign contributions were once again corrupting the system.
Because people have got to know whether or not their president's a crook. Well, I'm not a crook.
With the Watergate scandal and the corrupting influence of money on our politics, the public was pushed to the tipping point and demanded reform.
Congress passed a series of reform laws that were designed to make elections less expensive and prevent members of Congress, candidates, the president, which was at issue there, from raising literally million-dollar contributions.
The Watergate scandal resulted in some very important reforms.
Now, most of those safeguards and those rules after Watergate have eroded and been disregarded completely by the political class.
I would have thought we learned our lessons from the Watergate scandal, that having huge sums of money contributed to groups controlled by candidates or to political parties is simply a danger sign for a democracy.
Citizens United was a Supreme Court case that was handed down in 2010. What the majority argued in that decision is that corporate spending in a political context was an act of speech and therefore should be unregulated. It should be limitless.
The court in the Citizens United case has said a whole lot of things that I would think appear corrupt, most citizens would think appear corrupt, are not in fact, as a legal matter, going to qualify as corruption.
When Richard Nixon was drawn into legal trouble because of the influence that was peddled inside the White House, where people would bring suitcases filled with like $250,000, that won't happen today because nobody needs to do it in such a crude way today. All you need to do is to wire money to a Super PAC, and that's perfectly legal, even though it has exactly the same effect on the president or on a member of Congress.
Super PACs by law are not supposed to be coordinating in any way with a candidate's campaign, but it happens all the time, and it does because the FEC is just paying no attention to this.
What is a Super PAC? It raises and spends money making public ads that impact individual campaigns.
Single-payer healthcare, sanctuary cities, job-crushing taxes, and big cuts to our military. Pelosi's San Francisco values are wrong for America.
There is money that is surging in, hundreds of millions of dollars, that wasn't there the day before the Citizens United decision. Longtime political operatives realized the opportunity to game the system by setting up these patriotic-sounding organizations that were ostensibly to benefit society, but were in fact political organizations through which they could raise and spend tens of millions, ultimately hundreds of millions of dollars, with no transparency about where the money was coming from.
It's just a fraud perpetrated on our democracy. By federal law, there's a legal limit on the amount an individual can directly donate to a candidate for Congress. The current maximum is $2,700 per election. The law was passed by Congress to minimize the influence by an individual on the political process. The very idea of campaign donation limits has been undermined by Super PACs. Super PACs can funnel unlimited amounts of money that support the candidate, but technically are not coordinating with the candidate's campaign. And the money can be given anonymously. Super PACs pump in millions of dollars running negative ads, often spending more than the candidate's official campaign. Unlimited and anonymous money in campaigns is fundamentally undermining the democracy. It's against the expressed intent of Congress.
The Citizens United Supreme Court decision opened the floodgates to unlimited dark money.
You know, the way Washington works, it's not based just on quid pro quos, like, I'll do something for you. It's also based on sort of the opposite, which is, if you cross us, I will destroy you.
What they're being told is, you know, we happen to have this super PAC that has millions of dollars that destroys people. And by the way, we've got this one little provision we need in the budget, and it's really important to us and our constituents. It'll create a lot of jobs after it gives us a lot of money. And back to that other unrelated thing, we have this super PAC that, you know, destroys people who oppose us.
Dark money has an insidious impact on our politics, but lobbyist bundling and donating money directly to congressional candidates is an even more blatant example of corruption.
The leadership of both parties generally tells them that losing a freshman seat is a disaster for them. So they tell them, your focus needs to be on getting reelected. So therefore, we're going to introduce you in essence to a bunch of people who have ready money, who can help you pay off your debt. Now, where's the easiest source of money for these people? The folks hanging around 2 blocks away, the lobbyists. They have their checkbooks out, they're dripping in money, they want to give you the money. It starts even before they're inaugurated.
Members of Congress face massive pressure from lobbyists. Lobbyists need powerful members to push their particular agendas. Faced with hundreds of competing interests, the member has to choose what legislation they're going to fight for or fight against. Lobbyists who raise campaign funds know that money will give them an inside track in pushing their agenda. They'll have a big advantage over lobbyists that don't put up money. It's good old-fashioned pay to play. Money is a clear corrupting influence. Fueled by the power of campaign contributions, members of Congress go to work for their donors. Maneuvering legislation through Congress or fighting to stop bills their donors don't want. Lobbyists should not be allowed to give anything of value to a member or to his or her campaign or to a political party. By law, lobbyists can't buy dinner and drinks for a member of Congress, but they are allowed to host campaign fundraising events and bundle hundreds of thousands of dollars in campaign donations for that same congressman.
No other system in anything other than a banana republic is as corrupted as ours.
One of the many reasons why it's so attractive for members of Congress to leave office and become a lobbyist is because they make 10 to 20 times as a lobbyist what they could make as a member of Congress.
Pharma has an especially strong revolving door. It has nearly 1,400 registered lobbyists, and 65% of them came through the revolving door. Billy Tozan pushed through the Medicare Part D prescription drug bill that meant billions of dollars in profits for Pharma. He left Congress and went to work for Pharma as their chief lobbyist. He made more than $19 million between 2006 and 2010. So there needs to be a longer period of time before a member of Congress can go into a lobbying job.
If you had a 5-year period before you could lobby Congress, that, it seems to me, might change what is now being seen as sort of a tryout for being a lobbyist.
Both parties get money, especially when it comes to the pharmaceutical industry, where they've got lobbying teams covering both parties. They want to make sure that they've got control regardless of which party's in power. Data from Open Secret shows that for 2017, Pharma contributed to 127 Democratic and 126 Republican congressional campaigns. And they contributed to 44 Democratic Senate races and 30 Republican Senate races. They have strategically spent money to maximize their influence over both parties.
Neither party is doing this any better than the other party.
We can reclaim our democracy with campaign finance reform. Limiting contributions to smaller amounts would increase the power of the common citizen and limit the power of big money. Combining small donations with a 4-to-1 match of public funding encourages candidates to raise money locally. A candidate that receives a $200 contribution would receive an $800 match from the government. A $200 contribution is worth $1,000 to the campaign. It reduces the influence of out-of-state money. Candidates become more responsive to their constituents. It moves the power back to the local voters.
What we need is an amendment or a bill in Congress that publicly funds public elections. And if you required public funding of elections through the Constitution, or if you paid for it through Congress, then all of these corrupting dependencies can fall away.
It's a certainty that if we spent the money on public financing of elections, matching small dollar contributions, we would save many times over what's being spent.
As a business person, it makes total economic sense to publicly finance our campaigns. The tens of billions of dollars we could save through federally negotiating Medicare drug prices would save way more than we would spend on federally financing congressional elections.
Connecticut, when they adopted their version of small dollar funded elections, in the first year, 78% of the elected representatives opted into that system voluntarily, because their campaign managers told them, look, it makes more sense for us to go out there and get votes than to spend all our time in cocktail parties raising money from rich cats. And if they opted into the system, they would no longer be spending all of their time focused on what the tiniest fraction of the 1% care about. And they would have more time to try to figure out what the vast majority of Americans care about. That would be the way to deal with the problem of inequality caused by the way we fund campaigns. And Congress could pass that tomorrow and the Supreme Court would not touch it.
There have been a number of court rulings that have upheld the constitutionality of public financing of campaigns, so long as candidates are not required to participate, that it's a voluntary program.
The solutions are straightforward. We need a constitutional amendment that gives Congress the authority to regulate the raising and spending of all money impacting federal elections. We need to overturn the Citizens United decision and not allow unlimited contributions to bogus nonprofits. No money should be dark, no source hidden. We need to require 100% transparency for all campaign spending. Lobbyists must be prohibited from raising campaign dollars. After leaving Congress, members must have at least a 5-year waiting period before being allowed to work as a lobbyist. We need to fund campaigns with small donor contributions. These locally generated small donations would then be supplemented with public funds. If we can accomplish these things, healthcare reform and other reforms are feasible.
Thank you so much, Judy and Jen, for editing that great video. Jeff, I'd like to turn it over to you. Jeff Clark is the co-chair of Minnesota's chapter of Move to Amend.
Good evening, everybody. Thanks for being with us. Let me get my slides up here and I will continue. There we are. Okay, I want to get this down. Okay. All right, I got this tricky little thing where I gotta get the bar out here so I can start the slideshow. There we go. Okay. As Ann said, I'm actually currently a co-chair with Minnesota Move to Amend. I've been with them practically since the beginning. And I'm going to tell you a little bit about our organization, but not too much. But we're involved in what you could call a longer range solution that deals with problems in healthcare and a lot of other things we're dealing with. As so often happens when you're not just dealing with the problems of the next quarter, the longer range solutions that can solve things down the road also solve other problems too. And that's the overview I want to try to give tonight. I'll give you a little bit about the background to Move to Amend, the mission, structure, strategy, and goals, then on to our amendment itself and its purpose, why it's important, and then a little bit about how you can follow up and work with us. I may repeat this again, but later on, but what I'd like to emphasize is what we're involved with is something that helps all causes of social, economic justice, healthcare justice. Everything we're dealing with in our individual organizations could benefit if we had the kind of amendment that Move to Amend is working on. And that's why we often say, consider us as a second order priority for working with us as you work on your own issues. So let me move on here and give you a little bit about the mission. We intend and have built a coalition of hundreds of organizations and hundreds of thousands of individuals committed to social, economic justice, ending corporate rule, and building a vibrant democracy that answers to us, we the people. On the structure, there is a national team with a board and staff, and in fact, the organization began a few months before the Citizens United decision came out in January of 2010 because they knew which way it was going to go and that it was going to be a problem that they wanted to be able to hit the ground running when it happened. There are various caucuses, issue and sector caucuses. I belong to the education. There's one on labor. There are various other ones in which people work with them on particular issues. And then there are coalition projects where the organization works with other organizations. At the grassroots level, we are one of many affiliates across the country. We're in most states, not all of them, but Minnesota Move to Amend Network is one of those affiliates, and I'm proud to say we're one of the most active, including California, and us are probably the two most active affiliates in the organization. And then there are also Move to Amend advocates who are individuals who represent Move to Amend's principles and mission, and they may not be able to start an affiliate or be near one to join, but they serve as individual advocates. Now, our strategy overall has three areas. One is, as I think I mentioned before, coalition building. We reach out to other organizations working on corporate power affecting issues that affect all of us. We also want to build a broad, diverse, multiracial, and intergenerational movement, because all of us are affected by corporate rule in one way or another. And it strengthens the education so that people understand what it is we're working toward, so they can recognize that when they're working with their representatives, and we're getting closer to the goal of having an amendment. And then there are also grassroots organizing to pass local and state resolutions that call for an amendment. We have several municipalities and counties and other organizations in Minnesota that have done that already. That puts pressure on our state legislature to work on the bills that we have introduced every biennium since 2013 to 14. These are the ones that would send to Congress a resolution to ask them to create an amendment, to draft one. And I'll get into that a little bit more in a moment. So our two main goals are in our title: pass the We the People Amendment that clarifies that artificial entities don't have constitutional rights and that money is not speech under the First Amendment. And then also that larger educational issue, awareness issue of provoking discussion and organizing about how to make real the promise of American democracy through constitutional renewal. And you may have noticed at one point in the video we just saw, it was even suggested that the public financing might be something that would be embodied in an amendment as well as in law in Congress. That's another form of constitutional renewal too. Okay, the mechanics of amending the Constitution are two routes. One is both of them start with the states. 2/3 of the states have to ask Congress to do one or the other of these two things. The main thing that's usually done is to ask Congress to draft an amendment. If they agree to that when the threshold is reached of 34 states asking them, then 2/3 of them have to pass that draft, and then it goes to the states where they can ratify it. If 3/4 of the states or 38 of them ratify it, it becomes an amendment to the Constitution. The second route is the fallback position if Congress doesn't act. 2/3 of the states can ask them to call a constitutional convention instead. It's sometimes called an amendments convention to make it a little less scary sounding. But at any rate, that has never happened except with the first constitutional convention, which created a constitution. So it's one we've avoided up to this point so far, but it has a similar process. 2/3 of state legislatures ask for it, and anything that comes out of the convention of the states still has to be ratified by 3/4 of the states. Right now, there are 22 states, I think it is, that have asked Congress to create an amendment. The last two were the states of Virginia and Alaska. We would like Minnesota to become the next one, but it is not yet passed in both houses of the Minnesota legislature. We're hoping that maybe this next biennium will be the charm if, things go well in the election. But it would be good to get us into that group as being the next state to ask Congress to do this. Okay. So the bill we're dealing with is called House Joint Resolution 48. It always has that number ever since the first time it was introduced in Congress, because they've engineered it so they get that number every time the bill is introduced, and nobody has to remember anything different from Congress to Congress. We call it the We the People Amendment Bill. And that's something you can view at the link here. This will also be in a resource list that you're going to get along with the slides afterwards. I'm not actually going to go out to a number of the things I have links for, because they're things that you can review later on. But the lead sponsor is Representative Pramila Jayapal of Washington. This is her second time doing it. Before that, the amendment used to be introduced by our very own Representative Rick Nolan. He did it several times before he retired, and then Pramila took over. Currently, we have 90 co-sponsors and are hoping before this present Congress is over to get up to 150. Now, let me go over to the actual contents of this. This may or may not be totally legible on your screen, but it's something you can see later at that link. The particulars of this, there are two main sections to this amendment that we promote, and they involve two principles. The first section, in brackets, not the official text that's in the amendment bill, but it sums up what's in it, which are artificial entities such as corporations don't have constitutional rights. And essentially it's saying that the rights are rights of natural persons only, you and me, basically, not artificial entities that we create as people in society. And it indicates that artificial entities established by law don't have those rights and are subject to regulation through us at the federal, state, and local law. What they do have are privileges written into law determined by us, the people, through our federal down to the local law, and are not construed as inherent or inalienable, which are the rights that we have under the Constitution. And you may recognize inherent and inalienable from Declaration of Independence as well. Okay, the second section deals with that money is not free speech. And essentially the leadoff that hooks right into that idea of that principle is the closing sentence. The judiciary shall not construe the spending of money to influence elections to be speech under the First Amendment. That sets the principle. And then it indicates that our various levels of government shall regulate, limit, or prohibit contributions and expenditures to ensure that citizens, regardless of their status, have access to the political process, and that no person gains as a result of money substantially more access to influence elections of candidates and also of ballot measures. And the last one, most important, is federal, state, and local government shall require that any permissible contributions and expenditures be publicly disclosed. In other words, goodbye dark money if this amendment passes. The third section is a standard one that most of the proposed amendment bills have, is that we don't want anything in this amendment to be construed as abridging freedom of the press. Okay. Now, let me say a little bit more before I get on that one and have your attention distracted for a moment. But this is important. We consider these two pieces to be very important, and even other organizations which want to propose amendments that deal only with the money part in elections recognize this is also vital. Their strategy is maybe to separate the two. We think they work together and interact, so we propose, if we can get it, we would like an amendment that deals with both of them at once. The practical issue also is that if you don't do that, there is a very good chance that the second one will be forgotten and slip by after the first one gets passed. But they are interactive because we can tell the Supreme Court to allow the regulation of money in elections, dealing with super PACs, dealing with lobbying, everything else dealing with public elections, creating them. And that's one thing. But the other thing is that corporate money and big money that grooms candidates, gets them elected, holds them by telling them we'll continue to support you if you support us. Otherwise, we are looking to support your opponent next time the election comes up. In addition to doing that, they have to live in a world of laws that are inimical or not friendly to what they want to do. They're on the books from the local to the federal level. By having a new arsenal of rights, which are granted to them by the Supreme Court because they consider them to be the equivalent of persons, and with constitutional rights, they have a whole new quiver of arrows they can use to fend off laws in litigation, and they have used them. And that's why it's important to deal with both issues, because that third branch, the judiciary, has a big role in what our problems are. Every time something goes to litigation, if they look at corporate power favorably, more favorably than people, they can upend regulations that are made to control to benefit our communities. Okay, so to recap, basically the amendment would form a foundation. It doesn't solve the problem, but it levels the playing field. Then Congress has to do the work to write the legislation that would implement that, especially on the conduct of money in elections, and also writing laws about how corporations have to behave, because they will no longer automatically have constitutional rights. But the other thing is, then it tells the court that no matter what you do in cases to favor corporate power over people, you cannot any longer use the principles of money is equivalent to speech and that corporations have the rights of persons. Those two are off the table for the courts, and it's a way of reining them in when they become too political. So one thing I just came across recently, there's an overview of the whole problem, and Linda's going to be talking about following the money, but it just so happened The Guardian this very month published a summary on dark money, the quixotic quest to clean up US campaign financing. It's a good read. I suggest you look at it. And the other thing is something that Minnesota Move to Amend has produced and is a paper in progress, something we call Connecting the Dots on the Healthcare Industry. We invite you, if you want to look at that, because that will cover a lot of ways in which the healthcare industry has manipulated the progress we can make toward better healthcare that you may not be aware of. And if you look that over, we welcome outside eyes looking at that to make sure it makes sense, or you know things we didn't put in there, and you can help us improve the paper. So that's available for you too at that link. Okay, drilling down a little bit more, here's some other links you can look at. The national organization has set up a number of cases of legal examples of corporate rule in healthcare. This relates to different aspects of it. Click on any one of those and you'll find things that will amaze you as to how corporations have used primarily the First Amendment when they're considered as people to stymie regulations, legislation at the federal, state, and local levels for communities to protect and enhance themselves. Very interesting. It is just the start, though. Sometimes they touch on the other amendments that corporations have used too as people, which are the Fourth Amendment on search and seizure, Fifth Amendment on due process, the 14th Amendment on equal treatment under the law, and also the commerce and the contracts clauses of the Constitution. All of those have figured in litigational battles that corporations have set up to evade legislation and regulations that we have set up at every level from the local to the federal. Good reading and eye-opening. So I will just end with, if you would like to treat us as a second priority to be involved with, because we're looking at this long-range plan. You can find out more by going to movetoamend.org, the national organization. Also contact us right here at the Minnesota address for Minnesota Move to Amend. There are several people, including myself, who monitor that email account. And also on the resource list, I've provided more personal contact for me as well. I just didn't put it in the slide. And you can work with us either as an individual or as a representative of a cooperating organization. You may even be in one of those organizations now, because we have a number of endorsing organizations at that link, and you may find out that that's yours. One of them is yours. But we can work on together common bills and goals we have in common, not just our bills, but yours as well, because we have done that with other organizations. Work on those municipal and county resolutions that we want passed that express these principles, and also candidate pledge campaigns during election season. We do that as well to get candidates who may get elected to buy into the principles, which may help them get elected, and then they will advance our legislation when they're in office. So of course, this summer, we're going to have a gigantic campaign, because we probably have like 500 candidates we're going to reach out to before the November election. And we're working with the ones for the special election in CD1 right now. But at any rate, those are the basics, and I would be glad at this point to answer any questions you may have.
Thanks, Jeff. Just 1 second and I'll pull up the question.
Okay. I'm trying to reopen the Q&A myself here.
No worries, I can ask you the questions.
Okay.
Question, when you say other activists may need Move to Amend to attain their goals, does that mean the Constitution must be fixed before Congress will be free to vote for activist issues?
No, that would not be the case. I'm sorry if I gave that impression. What I'm thinking of more is we've got a lot of things, and in our organizations, we have successes with legislation. But what I'm suggesting is the long-range solution to reducing corporate and big money power that can fight the advances we make in our organizations and sometimes reverse them over time, as we're seeing with our voting laws right now and what's coming up in this next election. Those things could be enhanced in terms of making them more durable if we also had this long-range solution. But it is not necessary for us to be doing our work in our various organizations, whether it's healthcare or anything else.
Thank you. Next question. What progress has there been in the US Senate?
That's a good one. In the US Senate, we have been trying for a number of terms now to get a senator who will introduce our bill there as well. Haven't been successful yet, though we've had some close calls yet. The thing is that normally when they go in the Senate, they like to know that they're going to have people with them if they introduce the bill. So they say, get me 5 other senators who will go along with me and I will introduce the bill. We haven't been successful at that yet. There are bills in the Senate as well. There's another one called the Democracy for All Amendment Bill. I think that's in both houses. And Senator John Tester has a standalone bill that deals with those corporate rights, but he doesn't deal with the money in politics. He just deals with the corporate aspect. And he may be, I don't remember whether he's been approached to possibly sponsor our bill, but he's another possibility, long range. So, but we haven't gotten there yet in the Senate. We're still working on that.
Thank you. Next question. What is the current support for this amendment in the Minnesota legislature?
Okay. The way it is now is it's not going to get through either house because the bill hasn't got a requisite hearing before the end of this session. It'll be reintroduced in the next biennium. But basically we have a lot. We have nearly as many co-authors on the 2 bills in the Minnesota Senate and the Minnesota House as we've almost ever had, except for a couple of years ago, we were able to be at the state fair when there was one, and we got a lot of people to contact their legislators. We got a humongous number of co-sponsors that particular year, almost as many as the first year the bills were introduced. But they're not going to go anywhere before the end of this term until the climate changes, especially in the Senate, because we know the chair of the first committee it's in will not introduce it, and the majority is not going to vote for it. We're still not sure about whether it can make progress in the House committee, but we will keep working on it. We've been doing it every biennium since 2013 and 14, and it will click both places eventually. It passed in the Senate the first year it was introduced, but it hasn't done that since then.
Thank you. Next question. Are sponsors bipartisan?
That's a challenge. We have not had bipartisan sponsorship. It's mostly been DFLers in the Minnesota legislature. And part of that is, I have to be honest and tell you I'm not talking about names, but in terms of party politics, it is difficult to get people on the Republican side to sign on to something that's primarily been lead sponsored and primarily co-authored by DFLers. That's a challenge. It's a matter of one legislator told me, well, the party who introduced the bill here, he's never been very cooperative and reached out to us, so I'm not inclined to think of it. It wasn't about the content. It was about who's on the bill and how they behave in the legislature. And the other thing is, we do know from the past, one of my other volunteers in Minnesota moved to amend said they almost had a Republican who wanted to co-sponsor and was told under the table by their party, you don't sign on to that bill. And he backed out. We have a sister organization who's a co-sponsor of this event, American Promise. The lead coordinator in Minnesota has been working with Republicans to try to get a Republican version of the bill, which would be very useful. It would be similar. It might not have the corporate rights piece, but it would be lead sponsored by a Republican author, and it would be something that party could sign on to. But it's been a challenge ever since it was introduced back in 2013. It's been this way.
Thank you. Next question is, sorry, my cursor was acting weird. Are there other bills related to overturn Citizen United and other bills to end campaign finance reform?
Yes, there are. I mentioned there used to be about a half a dozen of them, in addition to ours. Currently in the current Congress, there are two main ones. I mentioned, actually, I mentioned briefly in passing both of them. One is called the Democracy for All Amendment, and I believe that is in both the House and the Senate, federal Senate. And then the other one is the John Tester bill I mentioned in the Senate. I think that one is only in the Senate. That's the one that only deals with the corporate rights piece. Democracy for All deals with the money and elections piece. And sometimes I go into an analysis, a comparative analysis of the two, and where from our move to amend viewpoint, they fall short, not just in not addressing the corporate piece, but even within the campaign finance piece, it's not expressed the way ours is, which we think is superior. But you can find that one if you do a Google under Democracy for All. I can't remember which actual bill it is, what the number is, but it's there. And also, if you look up our amendment on the national website, it does a comparison with the two existing bills and say, this is what's different, and it gives you a link to the bill itself, I believe.
Thank you. This next one is gonna be our last question before we move on to the next part of the program. How do you message this in rural Minnesota? One would think that rural folks would not be in favor of big corporate influence.
Right. That is, we constantly have to be novel with that within move to amend. Luckily, we work in coordination with the American Promise Coordinator, who is more often able to be out in the rural area. Especially, she has some contacts for legislators out there, but she can also attend local fairs and things to educate people. And she's been able to do much more of that than we have because of our limited core number. And that's been her complementary focus to what we're doing. But she's on board with any version of the amendment that can get through. So she's been working with us on our bills as well, and has done most of that reach out in the rural areas.
Great. Thanks so much, Jeff. Your
Sure.
talk was great and super informative. The next question actually brings us to the next part of our program. How can we screen candidates about their acceptance of super PAC money and dark money? And so with that, I'm going to hand the program over to our next panelist, Linda Gridley.
Hi, everyone. While Linda's pulling up her slides, I might suggest that everybody look at the chat. Jen put the address for Move to Amend in the chat. And if you want to sign up, Jeff, that would get you on the mailing list. Is that correct? He's off. Okay. Anyway, www.movetoamend.org. Okay, Linda. Sorry.
Oh, Linda, you're muted.
Just trying to figure out how to get my slides up there. Let's see, it should share screen. So share screen, but
Where's your slides?
there, I can't get this to go be smaller. How do I shrink this? Sorry, it'll just take 1 minute. Well, this is the first slide, but I need to be able to advance it, and I can't do that without sharing the screen. There. But now is that shared? Oh, slideshow. Okay. I think I have it.
Okay, you need to share your screen still though, Linda.
Yeah.
Okay, I see it.
How do I get rid of them? So my name is Linda Gridley, and I am a volunteer with Healthcare for All Minnesota. And over the course of this last year, I've been spending time following money as it affects our legislators. As our video showed us, there is a whole list of money impacting our legislators. And here's the list of various things that affect whether we get our healthcare bills through. So the first thing is campaign political action committees, which in the movie it was referred to as PACs. This is where money is gathered together to make a more powerful contribution to a legislator. There's other campaign money that comes into a legislator. There's personal wealth. Sometimes legislators have nonprofits that receive money that influence their votes. And then oftentimes they will be representing a community of industry or corporations that are in their state. And then also a lot of our nonprofits that deal with specific medical disease receive large sums of money from the medical product industry. And then oftentimes when candidates run, Democratic candidates run, if they're for Medicare for all, a lot of times the DCCC or corporate Democrats come in, they introduce another candidate, they load them up with money in hopes that they will beat the candidate that's for Medicare for all. I also have a slide or a link where you can go and look up all the various legislators to see how their personal wealth and the money coming into them affects their voting. And then we'll talk just a little bit about Big Pharma, and I have a list of information to give you of places where you can look. Sorry, I'm a little bit nervous. So first we're going to talk about the political action committees, and I am providing some links where you can read more lengthy descriptions of them. They're meant to be complicated so that it's hard for the layperson to understand them. But there's a federal PAC money that's without corporate or labor sponsored money contributions for a candidate. There's a leadership PAC formed by a candidate or an office holder. And then there's a federal PAC that's sponsored by a partnership or an LLC or any other type of unincorporated business entity that makes contributions to federal candidates. So just as an example of what it takes for a legislator to achieve a win, I started looking at Tina Smith because we were going to approach her about supporting Jayapal's single payer Medicare for all bill. So between 2017 and 2022, Tina Smith has raised over $17 million. She has spent close to 17 million. She has about $700,000 left. So this is just in a 5-year period of time that this is the money she has had to raise to stay in her position. And if we want to look at President Biden's run for president, it was actually the most expensive ever. It came in at $14.4 billion, which I don't know how we're even going to afford the next election with money like this. So the other thing that affects our legislators are their personal investments. And I singled out to legislators only because of personal wealth that would absolutely affect them, or I feel would affect them from voting for Medicare for All. So Tina Smith and her husband are heavily invested in the stock market. They're valued at around, their value is around 5 million, although in some articles it's as much as 12. And Tina Smith's husband is an investment banker who specializes in the medical industry products. And then, and as a senator, she has a salary of $174,000. So the next one that I looked at was Nancy Pelosi, who her personal value is 135 million. She earns 225,000 a year as a speaker. Her husband is also an investment banker. He runs an adventure capital firm, financial leasing services. So just their personal wealth alone would probably indicate where their votes lie. Recently, Congress has been under attack for insider trading, where they come out of committee, they know what's been discussed and how possible votes are going to go, and they will trade stocks after that. So AOC does have legislation which is against Congress owning stocks, and it also does include spouses dealing with stock trades. So another problem that is happening with our legislators is Nina Turner, who ran for a Senate seat in Ohio, was gaining ground. She was doing really, really well. And the DCCC and various corporate Democrats came in and introduced Chantel Brown. And not only did she take money from Republican mega donors, but she also brought in Senator James Clyburn, who endorsed her. Now he has a nonprofit. It's called the James Clyburn Scholarship and Research Foundation. And that foundation, when he endorsed Chantel Brown, that foundation received $1 million. And what he does is he hands out $100 to Black community youth students who are going to college. I'm gonna just. The next, right now, there are several races that we should be watching. One is the narrows in Texas, but right now in Pennsylvania, Lieutenant Governor John Fetterman is running for a Senate seat. And on Twitter one day, James Carville came out and saying that he was gonna sponsor Connor Lamb. He was gonna bring in all the big shooters, all the big money, and they were gonna make sure that John Fetterman did not win the Senate seat. So now Cigna, the insurance company, is sponsoring Connor Lamb. And then one other way that the another influence of money coming in, the Black Caucus recently received $1 million from Amazon. Money seems to just flow from everywhere. Bob Mendez, who is a Democrat from New Jersey, has voted against prescription drug pricing control. His state has 14 of the 20 largest pharmaceutical companies. And so he has taken $1 million from pharmaceuticals and is determined that we will not have any kind of drug pricing reform. But as my statement on the bottom says, he is representing his constituents. So my last slide is right about the time there was a lot of pushback from we the people about this insider trading that was going on with members of Congress. Business Insider did a great job of looking at every single member in US Congress and rating them according to any financial conflicts they might have. And all of these links, every one of these slides, you will get links to various sources of information. Now this one was a really hard one for me to look at. So we have all kinds of organizations that raise money for a particular medical condition. And I looked at both the American Cancer Society, which receives huge amounts of money from CVS Pharmacy and all of the various insurance companies. So they certainly are not going to be for Medicare for All because they're getting all this money to defeat them even beginning to support it. So this one was actually kind of bothered me the most. And I do have links for a couple of the nonprofits, and I've indicated the links to the donors that they to their donor list, and you can see what is affecting how they make the stances they make for Medicare for All. And last but not least, it's subsidizing big pharma. American taxpayers in 2019 paid $83 billion in research and development of drugs. The drug companies then get the patent for free or nearly free. Other countries contain their drug costs, so we American people actually subsidize the cost of their drugs. And then in 2021, Big Pharma, sorry, had a net worth of $88 billion. So someone might ask, where is the profit for we the people? This is my list where I get a lot of most of my information. Open Secrets, The Lever, ProPublica, Public Citizens, and last but not least, one of the organizations that is really has an incredible amount of money and pumps it into all kinds of advertising and buying our legislators is the American Healthcare Future. So questions?
Thank you, Linda.
Yeah. Sorry, I was so nervous.
No, that's totally fine. No worries.
So the first question.
My cursor's acting weird. Just 1 second. Okay.
Oh, I can read the questions.
Well, I'm going to read them live.
Okay.
It is clear politicians' investments need to be public knowledge, and politicians need to recuse themselves when they have conflicts. It does not seem reasonable to me to make stock ownership illegal. What do you think about that?
I'm not sure even how to begin addressing this problem. It would be nice if they would recluse themselves with conflicts, but I don't see that happening. There is possibly a way to make sure that when they leave a committee hearing, they're not going and making phone calls to their stockbroker or their husbands. But I certainly see it as a huge conflict of interest in how they vote. I mean, why would you be voting against your own pocketbook?
Linda, isn't it true that the bills that are being introduced, like the Disclose Act, I think that's the one. They're not supposed to trade individual stocks.
Right.
And they're supposed to be, it isn't that they're prohibited
Right.
from owning stocks, it's that they're not supposed to trade individual stocks that they
Right.
have insider knowledge about.
Right. Correct. But even when you own, now I can't think of the word, but even when you own stocks that are, when you buy a stock that's, I can't think of the word, multiple stocks in a program, I would still think that you would, I mean, we know what's in anything that we own. So I honestly, it's a tough question. It's a really, really tough question. But so Mark is asking, how can we use this with HCAM? Well, personally, I think we need to call them out and let them know that we know that they're representing their own pocketbook, and that it's their duty to represent their constituents and what's best for them. Does the $100 given to BIPOC students have to go for a campaign? So the question about the $100 given to BIPOC students, does it have to go for a campaign? So that $1 million that he got went to his nonprofit, and it was at the same time that he endorsed this candidate. So it does not go towards his campaign, it's going to a nonprofit. I think Jeff said that he was going to put the article for The Guardian in his notes, that you'll be receiving notes from both of us. Can you resource this? Oh,
sorry, he also just placed it in the chat.
Oh, okay. So the next one, can your resources be placed on HCAM website? I guess that would be up to the board as to whether they would want to. I will tell you one thing. So Bernie Sanders is going to be introducing the Medicare bill in 2 weeks in the Senate. And the National Nurses United is going to be doing a big power play to get support for the Medicare for All. And they are going to be targeting Tina Smith and making sure that she's held accountable in her support for Medicare for All. How they're going to do it, I don't know. I just happen to know that they will be. Oh, I was trying to read the lesson. Politicians almost always have insider trading information on stocks, maybe mutual funds. That was the word I was trying to think of, mutual funds. Well, hopefully mutual funds would solve the problem. But you would still know what's in there. And the problem is that the stocks that they own, I mean, this, in the case of Tina Smith and Nancy Pelosi, this is millions of dollars. This isn't like what you and I might have in investments in the stock market. They're raking in huge amounts of money off of knowing what's going to happen. So mutual funds, maybe, but we're at such a point with them owning single stocks that something needs to change. And even the fact that they're, you know, almost everybody that was in the Business Insider article, all of Congress is millionaires. And so do they know how to represent the people? And those are all questions that I certainly don't have the answer to, but it is something that we all need to think about. And certainly with the campaign financing, with the PAC money coming in, that PAC money it's bundled and it comes to them, and you and I have no idea where that money is coming from that's supporting their campaigns.
Thank you so much, Linda, for your knowledge on this issue. And I'm going to hand it over to you.
Okay, thanks a lot. Thanks, Linda. I think Linda's going to send out those sites for you to investigate. Have fun. Let's see. I'm going to go to the last. Pieces of information for this evening. So two of the specific threats to our issue this unholy alliance of major players in the medical industrial complex. If anyone on this call remembers back to 1993, Shades of Harry and Louise ads, which really sunk Hillary Care in the 90s, industry opposition to single payer financing reorganized itself fairly recently when it became obvious that Senator Bernie Sanders' presidential campaign in 2016 was really gaining steam and put Medicare for All in the spotlight. So please check out the ad that I put at the bottom of this slide. It's within Politico, article, did I say? In Politico from November 25th, 2019, and read all about it. The Partnership for America's Healthcare Future, and that's a euphemism if I ever heard one, PACHF, is these are major players in the medical industrial complex, mostly from the for-profit side of healthcare, but also includes members from supposedly not-for-profit sectors such as hospital associations and physician groups and others, plus others you would expect, the pharmaceutical industry, the medical device industry, and many more. They are ready to spend millions of dollars, maybe billions of dollars, to influence elections, push candidates, to push political parties, as Linda explained, to discourage candidates who favor Medicare for All and put in those who are either neutral or not supportive of Medicare for All, lobby office holders who are people who are already in office, run ads to scare the public, and create division among groups, whatever it takes to stop single payer Medicare for All type reform. And including even things that you wouldn't expect. They do not want any public influence or regulation any more than we already have on our healthcare payment system. And the other player, National Nurses United, is specifically running a campaign to try to oppose one of the biggest players in this alliance. And you might not expect, but this is CVS Health. It's a drugstore chain that has really expanded its influence by buying into the health insurance business. So CVS is also a big contributor to the partnership. I think they're as I read from NNU's information, they're the #1 dark money lobbying group against Medicare for All. So the link on this slide is a petition to call out and CVS. And Jen knows a little bit more about this campaign than I do. Jen, if you have any comments, go ahead.
Hey, everybody. Sorry, I'm a little sick tonight. So thank you, Anne, for pinch hitting for me. Yes. National Nurses United has been working on a campaign to spread the word about CVS. They've been working on this for about 9 months now. So what they've been doing is they've been getting people into CVS, actually doing small protests to get word out that they're funneling money to As the video said, this patriotic sounding nonprofit, the Partnership for America's Healthcare Future. And so in the chat, I put a link to that petition. So please, yes, healthcare failure, exactly, Mark. So please feel free to go ahead, sign that petition. When you do that, they will keep you updated on their actions. And also, I'm going to put in a link to they have you can watch their Medium blog as well. I'm going to quickly just share a photo of one of their nope, I won't do that because I don't want to stop Ann's. So they have campaigns that they do. For example, on Valentine's Day, they had people go into CVS and actually on their Valentine's Day Hallmark card area, they posted that they gave $5 million to the Partnership for America's Healthcare Future. So they're getting the word out. They are doing, and if you want to be a part of this action, it's an easy action. Click on those links in the chat. So thanks, guys.
Thanks, Jen. So what's the answer to all this bad news? Take some action. Help us build the people power we need to go up against the big money agenda. If I'm going to share some resources, some of the stuff you've seen before, if you've been to any of our programs, a little something that will be, a couple things that will be new this evening. If you joined our event this evening from an invitation you got from someone else and we don't have your contact information, please go to, and I'll scroll through slides, our website, which is hca-mn.org. Go under the, I think it's Get Involved, and it'll say sign up for our newsletter, but that actually gets you on the mailing list, and you'll get all of the invitations for educational events and direct actions such as Jen just described, and other activities. This is a little snippet of information from the latest report that the Minnesota Department of Health just published. This information is always a couple years behind, so it's from 2018, 2019. Dave Garibaldi, one of our super activists, gets credit for sending this one out, but it shows you the trend on health spending just in Minnesota. If we continue these trends under our current financing system, the cost is straight up over the next 10 years. We are set to double health spending in Minnesota. The full report is available on from the Minnesota Department of Health. I have a few questions for you, just as a little bit of a challenge. What will you do when you leave this meeting or going forward? And a note about the federal bill, the only members of Congress who are supporting the Medicare for All bill on the House side from Minnesota are Representative Ilhan Omar from CD5 and Representative Betty McCollum from CD4. 0 of our United States senators support the Senate version of the Medicare for All bill that Senator Sanders is set to introduce an updated version in the next week or two. We do have as you know, if you've been coming to our programs, we've got a newly active legislative caucus supporting the Minnesota Health Plan. We want to give them all the support we can, and we also want to add to their numbers. This is an election year, etc. You'll hear more about that from us over the next few months. And there was recently a hearing in the House, I think House Oversight Committee did a hearing on Medicare for All, and those hearings are usually available on YouTube if you might be interested in checking that out. So other things to do are to read Senator Marty's book, get involved. I got the website up for Healthcare for All Minnesota. PNHP.org is the national organization. There's a website for PNHP with tons of information. There's also a new website for the Minnesota, there's a new website for the Legislative Caucus and a new website for the Minnesota Health Plan.org. So you can always contact your members of Congress and ask them to support these bills, give you the number for the Capitol Switchboard for any issues you want to talk to your members of Congress about. And have you talked to everyone in your personal network to tell them why you care about this issue? And Organizing 101 is inviting others to events like this. This is just a list of, learn more about it, the more you know. the better you are able to talk about this issue. It is complicated and sort of polarizing, but we just really got to fix this. So Senator Marty's book is a must read for the Minnesota Health Plan, and you can go to our website for other resources as well under the resource tab. A few more websites for organizations that are really active and with us on this issue. And I also put a reading list in here for just on the issue of money in politics. There's quite a lot of information out. Nation on the Take is good by Wendell Potter, and he talks about not only the healthcare industry, but also just how money corrupts our democracy and what we can do about it. Dark Money is an incredible book, came out just a few years ago about the hidden history of billionaires behind the American right by Jane Meyer, and it's about the enormous influence of the Koch network. The Influence Machine is about the influence of the Chamber of Commerce, much bigger than probably people realize, and then a few things specifically about healthcare and health policy. Also, I want to call your attention again to our social media sites. We have Carolyn Hankey, who is working, is engaged in really updating and upgrading our social media sites. And I really am asking that you go in and engage with these sites and start pushing out the information that we've got posted, especially on Facebook and Instagram. Carolyn's doing a fabulous job of putting up, I think, interesting posts that you can forward. We have a YouTube channel, Healthcare for All Minnesota YouTube channel. All of these programs are on that channel. Please subscribe to that YouTube channel and give it some likes, and feel free to suggest content for our social media specialists. And then what's organizing 101 after getting on our mailing list and sharing events is having something on your calendar to join and engage with. Again, our social media sites are on this slide. The calendar has events coming up. We also have a few things on the calendar from organizations we are aligned with that you can check. An event recently was by the DFL Progressive Caucus, for example. This evening is the Big Money Agenda. Monday, April 18th, there's an event sponsored by Connections Lab about framing and talking about the Minnesota Health Plan, so specifically our state-based plan by the author, Senator John Marty. That's at 7 p.m. and you can go to our calendar and get a link to register for that. They're asking for donations. It's free. The event is free. Connections Lab does have to make money to stay in business, but they're asking for donations. I tried to do that when I registered, and it kind of screwed up my registration. So I think I'm going to go to the program and ask how to donate when I attend. Sunday, May 1st, we're going to do our first in-person tabling event. It's May Day. It's not a parade this year. It's a block party on Lake Street. And if you're interested in volunteering for that, we can always use volunteers. And one of the best reasons to do these things not only is to be a presence, but to get practice in talking about this stuff. And then Friday, May 20th is our fundraiser. Another, the first time that we'll be getting together as Healthcare for All Minnesota and Physicians for a National Health Program, and possibly maybe some members for Minnesota Nurses Association. And that's going to be in a picnic area next to Minnehaha Park. I've got a slide for that coming up. We are going to be tabling at the Twin Cities Pride Festival in June 25th and 26th. Another great opportunity to volunteer and get some practice. It's very busy, very fun, and really a lot of traffic. It's kind of like going to the state fair, and you get a lot of opportunities to talk to people. We're going to do Farm Fest in Redwood Falls later on in August, first week in August. That should be interesting, and we could use volunteers for that. Northfield is tabling at the Earth Day celebration April 23rd. Some of us are doing some of the conventions. We don't have any penetration into the Republican side of the political spectrum, but we're going to be doing some DFL conventions tabling. Please be thinking of outreach events in your local areas, and contact me for printed materials, buttons, business cards, etc. And our fundraiser, here's the details. please join us on May 20th. It's starting at 5 p.m., 5:30 p.m. You can come a little early. Share with your other organizations and invite. This is our first in-person event as an organization in over 2 years as a gathering. It's planned to be a fun and interesting get together, and we also like to raise the money. So we, Carol, who's our chair for events, Carol Engelhardt, has asked me to announce that there are a limited number of scholarship event tickets and vouchers for the food trucks if you need them. You can buy a ticket by going to our website, and there's a tab in the menu bar for the fundraiser. Please invite others, and we're also going to be inviting organizations who we are asking to partner with us. So the website, again, hca-mn.org to buy tickets, and come on out. And that's my contact information. Thanks so much for joining us this evening. And Jen or Judy, do you have any wrap-up comments?
Yep, I will do a quick little wrap-up here. Again, thank you everyone for joining tonight. We will be sending out an email sometime next week with the resources. We always do a little editing after doing the presentation based upon questions and comments that we received. So sometime next week, you should receive an email with a link to the recording of the webinar and all of the resources and PowerPoints shared. If you have any questions or comments in the meantime, don't hesitate to reach out to us. Jen, can you put your email and my email in the chat for people in case they have questions? And thank you again.